On behalf of our president, Gary Ludwig, and all the members, we are truly honored to have you with us today to talk about a topic that's exceptionally important to all of us. As COVID-19 continues to ravage our communities collectively, maybe it's time to take a break and talk a little bit about the mental health aspects of the COVID issue and problem. And what a most appropriate time in that this happens to be Mental Health Wellness Month. So with that, may I please have the next slide? Before we get started, I'd like to remind everybody that the audio is being broadcast using voice over Internet Protocol technology that's coming through your computer speakers or through your headset. Please make sure that your speaker or headset is turned up appropriately and the volume is correct for you. With that said, before we begin, if you have any difficulties, any technical problems at all, please contact WebEx support. That's at 1-866-229-3239. That's 866-229-3239 or www.help.webex.com. We'd love to have you along with us. Making mental health a significant priority is something that I think each and every member needs to do. We have an incredible panel for you today to describe and discuss some of the things that are occurring and some of the accessibility that you will have to information. And I think it's just a perfect time for us to have this discussion. Joining us today in the webinar will be Matt Mikulek. He certainly has a tremendous background. As you can see, he's head of clinical operations for the company that happens to be our sponsor today, and that is NeuroFlow. He's a board-certified mental health registered nurse. He's a former U.S. Army captain treating combat and psychological trauma and a public health researcher at the Leonard Davis Institute. Next slide, please. With that said, it's probably time to turn it over to Matt and get his input and some guidance as to how the program is going to go and the agenda will lay out. But I'm going to add just a quick personal note. Matt, before I pitch it to you, I had a chance to be a fire chief for several different communities for a while now. And with that said, we actually had one of the most horrible situations present itself in that one of our members committed suicide. It was a horrible day in the organization, very difficult for us to grasp and to come to grips with. And it's one of those things where we walk away wondering, what could we have done different? How could we have prevented that member? So I hope that we have that part of the discussion as well. I think every fire chief in the United States and North America, for that matter, and throughout the world, worries about the health and welfare, and particularly the mental health of our members. With this COVID stuff, reflecting back to your great military career, it's kind of like we're at war, isn't it, Matt?
Yeah, a little bit. Thanks, Chief, for kicking it over to me, and thanks for IAFC for having me today. I always like to think I'm a pretty outgoing presenter, so it's always hard to do these over webinar because I like to feed off you guys. So if I'm boring anybody, please shoot Richard and his team some messages that this dude's giving me a snore fest. Just real quick background. I just want to let you guys know that, my background's really in implementing these type of programs. So, both at hospitals in the Army and in the local community here in Philadelphia. I've worked on substance use policies and have led nonprofits as well. So really what I'm coming here today as a subject matter expert to talk about how we certainly implement these wellness initiatives with first responders and in the military. And I want to go back to your point, Chief, as far as the tragedy, right, that all of us have witnessed in our lives. Someone we know, someone that our friend knows. We've all experienced mental health in our life. And what's sad about it is it's a preventable tragedy, right? We know that people that attempt suicide but do not actually complete suicide will not go on to die from suicide for 90% of those. Let me try that again. 90% of people that attempt suicide and survive will not go on to commit suicide at a later date, right? So if we can actually prevent upstream people from getting to the point where they have the thoughts of suicide, where they are completing suicide, we can save lives.
It's pretty interesting. I've had a chance to see folks with a tattoo that's a semicolon on their wrist. And I thought, wow, how interesting. So I asked the person, and they went into the discussion about exactly what you've been describing.
That's right. And that's exactly what
symbol.
And I think what's sad about mental health is that we go right to suicide, right? That's the absolute worst case scenario, an event that we see. You know, same thing, working inpatient psych, where I saw very acute cases coming in, very preventable events happen to wind that person up in an inpatient facility. So what I really want us to take a lens and think about today is more about what does mental health mean to being a firefighter in particular. And one word and message that I think will be a key theme today is thinking about performance. Mental health leads to the most disability days of any other disorder, any physical illness otherwise. Mental health leads to the most missed sick days. It leads to us not being the top firefighter that we could be for our communities or a family member back at home. So while we think about this kind of continuum of suicide being at that very much extreme end, I want to talk about what else can we do upstream to really prevent those tragedies from happening, but also how do we have firefighters perform at their best, to be at their peak performance when they need to be. So I'll pause there. Chief, do you have any other thoughts before we move forward?
Yeah, just an interesting note I wanted to share with you and see if you've had experience with it, Matt. I've had a chance to chat with a person that had a semicolon on their wrist tattooed.
Yeah.
I asked them what that was, and they said, well, I attempted to commit suicide, but when I look at this, but there's more, has a colon in a paragraph. And I thought that was extremely interesting. And I think that goes back to that 90% of the folks who, thank God, doesn't follow through with that. Have you had any experience with that?
Oh, I mean, certainly I have, in the line of work, certainly there are some people in our lives that have chronic suicidal ideation, right? This is something that's always on their mind, whether it's from depression or some underlying disorder. So a lot of what we talk about with them is exactly that, is that that life, you can decide where to go from here, right? In this moment, and the pain and the symptoms that exist are what we're going to help with these programs. But if we don't make sure that firearms are in the house when people are having thoughts of suicide, if we're not making sure that they know who to call when they're having thoughts of suicide, if we're not have a program in place that they trust that they can actually go to, then we're not going to be able to prevent suicide. So this is going to be a whole community effort, and people like me who maybe have been on the front lines of mental health isn't enough, right? Because there's a big wave coming that we'll get into as we move forward.
Excellent.
Great. So quick agenda. Talk about the problem real quick. I don't think it's going to be stunning for anybody to see. Talk about some ways that we can move forward. And really my goal here is to talk more about how do you implement wellness programs in a way that firefighters will engage with them. And additionally, kind of using NeuroFlow as a case example of what we've done here in Philadelphia. But again, I'm not here to sell anything. I'm simply here to be the subject matter expert on implementing these types of programs. So if you go to the next slide. All right, so really what I want, big takeaway here, and again, I don't think this is going to be a surprise to anybody, but the rates of mental health disorders in firefighters is far beyond what it is in our general US population. You can see almost, if not double, what we see in sort of our normal civilian populations, if you will. And the key metric that I think is super interesting here, and I say interesting, whenever I say interesting, I'm always like, whenever a medical provider or firefighter says interesting, that's usually something bad, right? But what I find interesting about suicidal ideation is looking at rates of burnout. So we know that burnout in particular can lead to a lot of thoughts of passive SI. So these people might not necessarily be depressed. This is more related to the conditions that they're working in, difficult working conditions, shift work, demanding deadlines, repeated trauma that is experienced by first responder communities. Anything, Chief? I'm curious on your perspective here. Is this a surprise to you, or is this kind of what you would expect to see?
Well, I'm a little shocked about the suicidal ideation. To be honest, that's a scary notion. Um, Certainly, I know that we have to deal with it, like the vignette that I started with that happened to me in a major metropolitan city. And you know, I often wonder, we have to make sure that we hire the right individuals as well, ensuring that they're hardy on the front end. And I think when we do that and see these kinds of numbers, it really is a head scratcher. And I believe, and I mentioned it earlier, I would say with COVID, we're pretty much at war. I would have to say that I've never seen anything in my lifetime, and I'm sure other folks would go on to share that same notion. But boy, you're so restricted in so many ways. And when you're delivering care, particularly in emergency medical realm, you just don't know. Will I end up getting sick? So it's almost like it's dealing in a situation where the enemy is pretty much an unknown, which I would think would just exacerbate the numbers that you're sharing. Would that be a pretty reasonable observation?
Oh, for sure, for sure. And let's dig into that a little bit deeper. You know, again, the big takeaways, and this is normal environment, non-COVID world we live in. We know every day, particularly here, you know, in no matter where you are, whether in the metro areas, in the rural areas, firefighters have repeated exposure to trauma. We know that is absolutely a huge risk factor in suicidal ideation and developing mental health and substance use disorders. But they also are working really challenging shift work, right? No matter where you are, you guys all have crazy shift work where you're working 24-hour periods and working overnight, being separated from your family. But now you throw in COVID, and if you advance to the next slide, this is where things have really progressed. What I want people to understand is that with any major disaster, so whether we're talking like the Fukushima nuclear disaster or World Trade Center disasters and the like, there is always an increase in the prevalence of mental health and substance use disorders following these incidents. So this COVID is going to be no different. We're seeing rises immediately, and there's going to be lasting effects, mental health effects from this pandemic. A lot of that has to do with certainly the anxiety, fear, and uncertainty. We all know there's economic uncertainty right now as well. It's really contributing to that. And then making it even worse is now we have all this additional stress, we're maybe still having to go to work and respond to these repeated traumas, but you took away all of my coping skills, right? I can't go to my friend's house and barbecue anymore. I can't go bowling, can't go to my bowling league tonight. I can't get out to the park to even go work out and on the great public works projects that have been done here in Philly to work out in the parks. So we have more risk factors, we have less ways to deal with them. And then on top of that, we're looking to place blame, right? So there's certain populations that are even getting it worse where we're stigmatizing, right? And so whether that's Asian communities here in Philly that have been stigmatized or elsewhere, making sure that we really don't try to place blame and we work more on how do we improve the coping skills and resources available to firefighters. I'll pause there for a second, Chief, if you have any.
Well, before you move on, the other part I'd love you to opine on deals with control. I've had a chance to be a firefighter for a long time. Richard Miller back at IAFC headquarters would contest to that fact. With that said, you arrive at a situation, and I'm going to go back to spending 21 days at Katrina. And each and every day, you saw a little bit of improvement. And you knew here was the game plan for today. And when we get through these 21 days, the buildings will be searched, the precious human remains will be covered, gas will be shut off, water will be restored, and I could go on. With COVID, boy, turn on the evening news, Matt, and the dynamics change incredibly. And again, it's just a feeling of total loss of control, as in like, what's going to happen next? Is that a reasonable perspective to bring forward and to get you to say a few words?
Oh, 100%. And we know control is a big thing for first responders in particular, right? So if you go to the next slide, it's actually the very next thing I was going to touch on.
Right.
So yeah, great segue. You know, the way we help with uncertainty is education, right? Uncertainty about the coronavirus, understanding that when it's going to end, what can I do to protect myself? This is all information that exists that we can help educate our firefighters and our communities with. So really, how do you engage them and make sure that they're getting the right information is really the point of emphasis here. right? So, so to your point, Chief, my answer would be how do we educate them on what's going on? Make sure that they feel up to date, feel in control with what they can control. What are your thoughts? What else would you think you'd be doing?
It's sort of a double whammy, for lack of a better. We're losing control, and there's no way to grasp upon that information that you just described. At the end of the day, we hear something new on the news. Is it reality? Is it fantasy? Is it somewhere in between? How many folks are going to die in our nation? How fast the potential virus can spread? How long will it live on surfaces? None of that seems to be into hard science yet. And you said that first responders like control. My goodness, I think a fire chief comes out of the womb wanting to have total control. So it just drives you nuts. On the middle end, it's hard to remember this has got to be the marathon. If you're in it for the sprint and expect the answers to come out soon, well, they're not going to happen. And the other thing is, it's almost like I have a morning edition of what our policies relating to COVID is, an afternoon edition of the policy, and a nighttime edition. And if you're not really flexible, I don't know if that's me or not, feedback. If you're not really flexible and have the ability to, so to speak, roll with the punches, you're in trouble mentally.
Yeah, and I guess, what we talk a lot about when we work with patients is perspective, right? What does it help me to be a firefighter to understand the national statistics of what's going on versus understanding what's going on in Philadelphia, right? So kind of helping to frame things, helping to frame perspectives. What do you need to know? What information is going to be helpful to you? That's what I think is really important is keeping things in perspective, making sure that we don't give false hope. I think that's one thing that we often go to that ends up being very detrimental, which is don't worry, in 2 months from now, this is all going to blow over. We're all going to be fine. And then 2 months from now it hits and we weren't mentally prepared. We weren't physically or mentally prepared for what was going to happen next, right? So I strongly advise against any sort of false hope. It's really about just providing that education the best we can, making sure people know where they can go when they need that information.
And I think all of this is leading to ensure that we have a proper foundation about mental health, mental wellness from the time we hire an employee until their retirement, and honestly, well beyond that.
Yeah, absolutely. And I'm just gonna keep rolling because I think this all ties together anyway. It's certainly how do we also identify the people that most need help, right? So we know that in our population, as firefighters in general, right, we're going to have higher prevalence and incidence rates of depression, anxiety, substance use. I didn't even touch on child abuse and domestic violence, which is absolutely on the rise right now. How do we identify that? We need to find ways to assess and monitor for our populations to see if what these trends are and how we can intervene. Are there points of opportunity to know where programs should be implemented? So really being able to gather that data on our firefighters is critical to be able to react. And then the last point here is just being able to deliver care, right? So we know that there's already been a bottleneck with mental health, often 2 to 4 weeks for waiting to get an appointment. We can't stop delivering care. So we need to find alternative, creative ways, whether that's telehealth through your EAP or otherwise. We really need to make sure that we're connecting people with the resources they need. So I'll pause there before we kind of get into more general how to actually implement programs. Good.
You're pausing for me as I think you're going through these items, which are excellent in the foundation for a solid mental health program. I would also say somewhere in there has got to fit in the ability to simply be there, to be there in person, to listen to the expectations, to listen to the concerns. Matt, I can see you smiling.
Yeah. I'm smiling because you always hit my next point. You're like, we're on the same wavelength. Yeah, if you go to the very next slide.
Can I share a story before you get moved on it too far?
Sure, absolutely.
One of the major cities in the South, kind of the New York of the South, so of course I'm talking about my time in Atlanta, we responded to a gentleman that was going to jump off of a bridge. and we had enough time for even me to arrive. And unfortunately, the gentleman did exactly what he had advertised. And when he hit, it was a tremendous thud. It sounded almost like a watermelon. His head split open. I could go into the details, but you get the idea. And of course, trying to be a good chief and to focus on being there, I asked about critical incident stress management and bringing in the team. And everybody denied me. It was like, get out of here. We're fine. We do this for a living. We're firefighters. We see worse than this, yada, yada. So I thought about it, and I sent two pastors out that had the background in the area that we're talking about, critical incident stress debriefing information, and to get that process started. And they visited each firehouse that had responded. And of course, when they got there, they were sent away, and the pastors, I told them to expect that, and they asked for a cup of coffee. And before you know it, they're sitting at the dinner table. And before you know it, the cup of coffee blends in itself to having a discussion, if you will, about what just occurred. And then they begin to open up. So if I would have taken that curse, look, Chief, we're fine, from a few people, I think we would have missed an opportunity to have a open and frank discussion. I did not go there. It was the folks that had to deal with the situation. I stayed at headquarters. When the two pastors came back and we had a couple more cups of coffee together, they were really excited by the fact that they were welcomed in. But again, it took about a 15 or 20-minute window of wheedling their way in instead of saying, look, we've really had a horrible experience. Now help us get through this.
Yeah, and I think this goes off of a question that was also sent in as far as how can we in the community best support each other. What I really want to be, this is a point I want to make toward the end of the presentation, but I guess I can't make it too many times. We need to be checking in with each other, right? This is not the responsibility of our EAP or one individual at each unit. It should be the responsibility of every single person in the firehouse to be checking on at least one other person in the firehouse. And when I say that, I don't mean shooting a text, because that's what we like to do. That's easier, it's quicker. I can send more than one at once. But that's not the proven way to get that engagement we need. We need voice, so you need to be placing phone calls, actually calling somebody, asking how they are, or through video. So I've had home Zoom happy hours, right? Having a beer over Zoom, it's cheaper. That's the only benefit. But that is the way that we help each other. And one way to do that is have everybody pick two people, assuming that there'll be some overlap there, to check in with. The guidance is to try to check in every business day with everybody. I think that's a bit of a burden, but at the same time, I think we need to be trying. So absolutely, as much as I'm here to talk from what technology can certainly do to assist, there is no replacing voice and video calls with each other. And that's the best thing you can do. If you want to log out now from the webinar and just go call somebody, that's cool. I won't tell, IAFC that you left.
Let's not do that though, folks. Hang in there. This is really worth your time. And with that said though, what a great benchmark, Matt. Every day I need to make contact with two of my members. Actually, I love that. I'm going to steal that from you if I can. And, simply being there, showing up, being a part, it's a powerful, powerful, powerful tool.
That's right. And it's not easy, right? It can be awkward kind of having conversations, particularly if someone you don't know very well. But I promise it gets easier, and it's well worth it, and people will be happy. Also, the other thing I would say is show appreciation for each other. I don't think we do this very well anywhere, quite frankly. Just thank people for what they're doing, right? And I know, my military background, you guys are first responders, would be like, oh, you're, that whole, you're a hero kind of tripe that we get constantly, right, is great, but it becomes very meaningless. When you hear it from a peer, from somebody that you really care about, and somebody that means something to you, that you made my day better, that you made my week better, that's really meaningful. And having that purpose is really something that assists with mental wellness.
I love that. What a great takeaway, Matt. What a great takeaway.
I try to do that. I try to do that a couple times a week to people on my team that have been helping me out, because it's selfish, right? It's about retainment too. about making sure that the people on your team that are doing a good job get the credit they deserve.
They tell me you ought to train people like they're going to leave the organization, and you ought to treat them well enough that they never will. And I think you got that message.
That's right. That's exactly right. So I'm going to go over just a couple key points, certainly that I've learned in the military and working with first responders as far as implementing mental wellness programs. Understanding that we're a little bit of a different animal, right? One big thing, and I think everyone will be nodding along with me with this statement, is that there's concerns over privacy, right? I'm not going to maybe say it's paranoia, because I think that's a little over the top, but certainly we are a little fearful of Big Brother. So the very first thing you have to be doing with any program is talking about security and how their information will be protected. And one way we do that is not just by saying, like, we're a technology company. I can't just say, hey, we're a HIPAA compliant, our data is protected at risk and in transit by multi-layer hardware and software encryption, right? That doesn't mean anything to anybody. So really the first thing I would do is determine the type of credibility that your organization already has. So, your fire department, your EAP, what is that reputation like? Because if it's great and strong, you can use that. But if it's weak and the word around the water cooler is that it leaks like a sieve, then you shouldn't emphasize that this is a program led by the EAP, right? So understanding where you stand, giving really credible examples of who else is doing these type of programs. So for us to be able to go into Philadelphia Fire Department and say, hey, look, we have contracts with the Air Force. We're working with one of the major health systems here in the city. Here's what we do. Here's who we are, introduce ourselves, right? These are the ways you start earning that trust and the security sense. And probably the most important thing here is to never go back on your word. So once you say what the program is, don't backtrack, because once you lose that trust, it's gone forever. So really what you need to make sure is you understand exactly what that program and security procedures are going to look like and stick to it. Next thing I'll kind of throw out there, same vein here, right, is identifying champions. Who in your organization is the unofficial leader, right? Chief Rubin going in here being like, hey, this is a great program, isn't going to do anything. It's about the peer level. How do we get them to talk about it with each other? We know that if we just launch a new program and let it go, no doubt that our members are just going to talk crap on it, right? It's fun to do, it's easy, it's fun to take cheap shots. So really include the firefighters at every level in the planning, implementation, and in the messaging that you do. One example for us is that we included the battalion chief of the Philadelphia Fire Department that's really well respected in our introduction video to them. So the first thing they actually saw when they were doing activities on our platform was their own battalion chief. We talked about this already, but messaging should never be about mental illness with these two populations. We're very sensitive to it. We're very sensitive about the PTSD aspect of firefighting in that life. So really avoid saying anything about mental illness. It's really about making you a better firefighter, right? It's about making you a better partner at home. And these are all true things, right? We're not deceiving. It's just a messaging and perception issue that can go a long way. And the last point I'll make, and I'll take a breath, is that we really want to incentivize people to do these programs. So is there any sort of financial incentives you can offer? One thing we're working with the Air Force on is offering 4-day weekends. So if they reach a certain threshold, they get extra days off. We know that if it's a big lift to get involved, people are not going to get involved. So how do you bring it to them? How do you make sure these programs are located in their firehouses where they need them? I'll pause there. Chief, any thoughts before I move on?
I would say the power of that informal leader that you mentioned should never, ever be discounted. And if you can get the informal leader engaged on the front end, and especially, so to speak, get their fingerprints on the knife, as in like how to develop the program, it sounds like you did with the great Philadelphia Fire Department, that's just a winner for everybody. And I think we all know and realize that. It's great being the chief. It's great having all the, what we would call toilet plungers on your collar, speaking trumpets actually. But in reality, that informal leadership where you live and sleep and work with and go on calls with that woman or man next to you in the workplace sense, it's very, very powerful. So I thought that was great that you brought that up as well as a very, very meaningful way of ensuring everyone is okay. I reflect back to the day watching that gentleman jump. Just again, it was horrible. And maybe if one of the informal leaders would have come and had a chat, maybe if I would have been on top of my game and asked them to have a chat, maybe those pastors wouldn't have had to slow down and spend the 20 minutes of earning a little credibility before each of those stations opened up. But that's, I think, another great point that you bring out.
Absolutely.
A military background always shows, sir.
I don't know if that's a good thing or a bad thing, but all right.
I think it's a great thing. I admire it, sir, truly.
So what we're going to do next is kind of go forward. And again, I'm not here to sell NeuroFlow, right? I just want to be clear on that because I really want to make sure that we're using this time to talk about how we can help you. But I want to use NeuroFlow as a case example so that we can go through and talk about how do we implement the programs and utilizing some of these, everything we've been talking about together to make sure that it was successful. So quick background on what NeuroFlow is. We are essentially a technology platform that allows us to remotely monitor, so see how people are doing, and then engage those members or patients with activities that are related to them. So that'll make more sense in the next slide here. I'll kind of get more into it. But basically what we're able to do is measure through validated health assessments. So these are things like that you take in the doctor's office, right? So a PHQ-9, GAD-7 for anxiety, depression. We have a PCL, which is for PTSD and the like. But also subjective measurements. So thinking about like mood, sleep, pain, stress, those sort of things. And then also biometrics. So we're able to collect things like activity data and heart rate data, where we're able to then aggregate that all together to create a picture of what an individual member or population looks like, right? And so kind of taking that to the next level, then what we're able to do with that data is to help really two layers of people at the firehouse in particular. First is the administrative side, right? So our commissioners, our chiefs that don't necessarily, not that they don't care, I mean, choose my words carefully, but they're much more interested in that population health level data. What is going on at my whole fire department, where they want to know what are the rates of depression like amongst my firefighters. So we're able to get that de-identified data, where it's simply just looking at the group of firefighters and what's going on, and then separately offering that individual level data to the care teams that actually give care to firefighters. So we're able to alert them of firefighters that have endorsed thoughts of self-harm. We're able to provide the resources needed to people that have severe depression that we've identified to make sure that they're getting, that they know exactly what is offered to them through their EAP and other programs. And finally, the last thing we do is we're really great at motivating people, right? So we're an engagement tool where people are able to both track their own health outcomes, so they're able to see and track how they're feeling over time, but also be able to do any sort of education resources that they need related to mental wellness and mental health. So that's just background so you understand who we are. If you go to the next slide, this is a little bit of what the app design looks like. But basically some of the activities we were doing with firefighters is giving them some automated prompts. So making sure that, hey, we'd really like to take your assessment today, see how you're doing. That assessment then determines what type of content follows. So if Chief Rubin took an anxiety assessment and was severe for anxiety, we could then direct him directly to anxiety related content material. Versus if I took it and did not, I might get something more like resiliency content or positive psychology type content where it's about, again, performance. The next thing we're able to do is help you track what's going on. So whether, again, a whole host of data points that you're able to collect on your own and track and see over time. And then we give you feedback. So based on the outcomes that you've been having, we can tell you, hey, it looks like you're doing better in these areas. Could use some work in this area. We talked about incentives and how important those are. We have a gift card functionality where you get points and you redeem those for gift cards. So that was a big part of the PFD rollout was making sure that we had the right gift cards on the platform for them. We have content libraries, so being able to go in there and just learn about stuff, right? So just because I don't have depression or PTSD doesn't mean I don't have a friend who does, or I don't have a patient who does. So giving the education and resources available to learn about these things and making it super easy to sign up, which we can talk about as we go into the actual case study here. So we rolled out with the Philadelphia Fire Department back in October. So this was originally through a city grant that we got. And we have a great relationship with the fire department. They're amazing people and very innovative. So it's been quite fun working with them. And some of the challenges we noticed right off the bat was that the only information the department had was city emails. So there was no cell phone numbers for any members at all, or personal emails for that matter. So we knew that the typical way that we onboarded people or got them registered was to send them a text message right to their phone, right? So that way it's nice and easy to sign up for you. But we didn't have that option. We also knew that firefighters were not logging into their city emails regularly, and that you couldn't open up city emails on your phone. So as silly as a point as this seems, it was quite the technological challenge for us to overcome. We also, again, I can't stress this enough, because if you do a program, you're going to see it, the privacy concerns and stigma around mental wellness, and just not wanting to share my information with this device that I have no idea about. And any new initiative is gonna meet friction. I hope everyone accepts that at this point. But we knew going in that it was going to be a challenge, because there's a lot of players and a lot of different people involved in wellness, particularly at a large fire department like Philadelphia. So what we did to overcome that was we got on the ground. So we had a bunch of our team going to fire departments, and this includes not just people like me, but we had like our designers there, we had our marketing team there, we had our couple sales guys just go out and just to understand what we were even getting into. And that gave the firefighters a chance to meet us as well. We did a lot of print material, a lot more than we normally do. So thinking about printing posters and getting those hung up in key areas for fire departments. And we also made an organizational code. So this was new to us as of this rollout, where instead of needing to go through my text message or email to register now, all I have to do is put in my email and this code, and then I could register. So it made it much easier. And again, really had the messaging and support from the employee relations office, where they were involved in making videos, because all of our videos and content's customizable. So we're able to make those videos specifically speaking to Philadelphia firefighters and emergency responders. So bottom line up front, right? I guess not so much up front at this point. But what we found was we ended up getting 11% of the department is registered. Again, through these, mainly through getting on the ground and talking with people. The average firefighter completed 27 activities in the first month. So that's almost every day they were doing something, right? So whether that's rating their mood or sleep, or completing one of these assessments or other activities. We have multiple members now that have over 100-day streaks, which means that they've logged in every single day for over 100 days. I think the longest one's 140-something days right now. Blown me out of the water, because my longest was 8. So they beat my record. And then 38% were still engaged after 6 weeks, and we still have high engagement rate beyond that as well. And we're nearing 1,000 questionnaires now collected for the department, which again is only helping to inform where programs should go, maybe evaluating ongoing programs and using that data to really improve what we do and how we deliver care. I'll pause there for a second and take a breath before we move on.
Thanks, Matt. You made a comment about how difficult sometimes new programs are to get off the ground. And I would say that firefighters only dislike 2 things. One is the way things are. The other is change. So yeah, it's true. So get used to it and understand that. And I think listening to the numbers and not drilling down, because I know that the confidentiality is so critical, but it sounds like there's been a lot of faith and trust and true partnerships built up between you and the average member of the Philadelphia Fire Department, not necessarily the top echelon or even the middle echelon. And I think that's where the rubber meets the road. You mentioned roughly about 11% to get started, and without giving up any trade secrets, about what kind of numbers are you seeing now?
Yeah, it's still very high. The number I was actually going to throw out, as far as thinking about, great, Matt, this sounds cool and all, but are people actually being truthful when they're taking these assessments and being involved? Within the first, just the first 4 weeks, I mean, we had multiple people endorse thoughts of self-harm, which is not at all surprising, but we found quite a high number. So we're talking over 10, right, in the first 2 weeks. Wow. So we're quite confident that people were being very sincere looking at the results we got back, as far as looking again at that de-identified level of data, where we're able to see what was the actual population looking like. And yes, and continuing to this day, we have, and we're now, more than 6 months removed. We still have quite a fair number of engaged participants, and we're actually onboarding more because we're working with the Office of Emergency Management and some others as well. So, kind of did our initial rollout, and now that the first 6 months went well, we're actually on our second rollout now.
I know they're doing just amazing things there, but I wonder about the incentive program. This is a long-term structured event that your office is going to continue to head up to help out the fire department and Office of Emergency Management, and maybe Philly Police as well. Will the incentives always be there?
Yeah, absolutely. I mean, that's a big part of what we do is behavioral economics, right? That's the whole key concept here. So we worked with a Penn Nudge unit, which is very reputable as far as making people do the things we want them to do, right? Behavior change. And one huge way to do that is to offer incentives. So we do that a couple different ways. Is the gift cards for sure, which again, you're not going to get rich off of this, right? The idea is not to pad your retirement, but even just small financial rewards are enough to keep people engaged for much, much longer periods. So that's certainly one. Yeah, so that's one component of it is the financial aspect. We also do badges and streaks and all kinds of other gamification that you'd expect with a consumer app, right? We don't feel like a clinical app where it's very consumer feel, and able to track your own data has also been shown to make people want to engage more. So when they can actually look at those trends and track them over time, people are more interested in engaging. So there's a couple of strategies we use to keep people engaged.
Excellent. Thank you.
Yeah, absolutely. All right, we can move on to the next slide. All right, cool. So kind of backing back out now from NeuroFlow and kind of our work with Philadelphia Fire Department, just to talk more about COVID and some specific tips for y'all. The first one is what we touched on, right? But I think it's worth reiterating again. We need to be checking on each other, and it needs to be through voice or video. Don't just email, don't just text. It feels insincere. Usually you don't get to gauge how that person's actually doing. I can respond okay over an email, and that's but you can detect how I'm feeling over voice, right? You can go that extra mile. Make sure that you really have in place reporting and surveillance related to domestic violence and child abuse. And really what I think about here is how do we discreetly make sure that those people have those resources available to them when they're in their home. Everybody's cohabitating right now. Kids are not at school. We know this is happening. So what can we do, and how can we help with the reporting and interventions there? We also need to think about stepped care. And what I mean by that is we can't just have everybody who has mild depression or higher to go to therapy. There simply is capacity issues with mental health treatment. So being able to have some protocols in place and knowing where do we direct people based on their severity level, and how do we assess that? How do we determine where people need to go? And maybe that's not your decision as a chief. However, that's something that your EAP and wellness programs really need to consider is how are we directing people to care in a way that when I have somebody that is super severe and needs care now, they'll be able to get it. So thinking about the different levels of care and where you can intervene. And we have some free resources that are just up. We felt it was really important to just dump everything that we had available as far as mental health and thinking particularly in this population with provider burnout. So feel free to stop by those websites to get some additional tips here as far as what you could be doing yourself, could be recommending to your fire department members. And please reach out if you have any questions about those as well. All right, I'll take a quick pause there for a minute.
Again, I think you're absolutely right on track and reiterating some of the most critical elements that you've described, checking on your folks and having a intervention ready to go. And in this case, when your company is doing some of those interventions, fire administration most likely won't know anything about them at all. Is that a fair statement? And that's got to be exactly the strength of this program. I'm just so impressed, truly.
Yeah, I mean, the goal here, right, and the same was true in working inpatient psych, is once you got through the doors of inpatient psych, your commander and everybody knew, right, of what was going on. How do we prevent that from happening upstream, where this is not a distraction for administration, not a distraction for the firehouse, and most importantly, keep that person healthy and high performing, right?
Excellent.
Cool. So the next slide here, I just, it's funny. The first time I did a COVID webinar, my mom Facebook messaged me because I always laugh when people think that old people don't use technology because my mom is on Facebook way more than I am. She sent me this article about how the WHO is no longer recommending ibuprofen for COVID patients, and she thought it was funny because, again, Army medicine, it's ice and ibuprofen. That's like a running joke for us. But I thought about it, and I went to the webinar. I went to the WHO site and their Twitter account, and immediately on their Twitter account it said, "No, this is false. It was a double negative. It's like we're not recommending ibuprofen." So it was basically a hoax, right? It was something that was misreported. And the point being is that's kind of a minor one. Maybe that didn't end up being a big deal for the most part, and maybe people have the right information now. But how quick that spread, and WHO was not able to contain that fire. So do your part to make sure that you're giving out information that is accurate. Learn the basics about COVID. What does it mean? How is it shared? Make sure that you're always understanding what's going on with your community. And again, I know I'm speaking to the choir here, I'm preaching to the choir, but I think all of this information is really important that we're all in agreement with. And making sure that you report misinformation when you do come across it, because it can be detrimental to a community. And certainly where we're always going to for references is CDC for certain. Johns Hopkins and WHO are always great resources. So just know where you're getting your information from.
Excellent. Let's move to the next slide, Matt.
Yep. So the last thing I'm going to talk about is just who we are. So NeuroFlow, I am super proud to work here. It's been a great opportunity. My CEO is another former Army captain. He actually was a platoon leader during Operation Iraqi Freedom, and he had a service member come back and complete suicide despite recognizing this patient. We screened him, we found him. We were both at Fort Hood. He found this, recognized this person. He had medications prescribed. He had an appointment to see a therapist, which was co-located in the same exact building as the physical health. Never got the prescription filled, never sought treatment, but there was no way to track that. So that's really been a lot of the underlying story that's kept us going is how do we keep people informed of where to go, how to go, and also make sure that there's some oversight to make sure that if they need that nudge to get help, that they're getting it. We've won a whole bunch of awards. We love, we're passionate, so our passion always shows through, both through our product and through any sort of pitches we do. And we work with great organizations, which make things much easier. You mentioned Philadelphia Police. It's a new contract we're working with. They've been just amazing to work with. Great community here. We're with the Air Force and some other great health agencies as well. So I'll leave it there. I think it's definitely time for Q&A. I'm sure people are sick of hearing me at this point.
A couple of reactions on my end. Again, I thought that ministry of being there, how critical. It's just so important to play that role. And I think by the International Association of Fire Chiefs, having this event today, sponsored by your great company, speaks volumes. The fire chiefs need to get involved with this. They're never going to be clinicians. They're not going to be in a position, most at least, to be able to do that type of work. So just like in any other area, to reach out to a company that's got a great reputation, that's got a great handle on the work, and to make sure that our members get that mental health that's so important for keeping them there for a career. It's just worth the time to spend this hour on this webinar to learn from this great information. Do we have any questions? I don't know if the home office is going to send them out to us.
I see one question here. I can certainly address as far as the so I'll just read the question. So I noticed with the stay-at-home orders in our state that ones are irritated or closed up due to the political scene, which makes attitudes and morale suck in the firehouse. Any suggestions to bring the family back and get back to get that break from this? I'm assuming this is referring to the firehouse, right, in the community itself, and I think any way you can engage each other in any sort of activity where you're talking and engaging with one another is the way to go. So that might be games. One thing we do weekly here at NeuroFlow is we play Jackbox games, which are like internet games, and we play them over Zoom. So that way we see each other, we can talk to each other, and we're playing an activity together that's bringing us together. So that's my initial thought is certainly how do you get people thinking about something else for just a minute, right? And engaging with other people. That's what I see. Any thoughts, Chief, on kind of how you can help with that?
I'm not sure the core of the question. In our community, obviously the firehouses are still staffed. The ambulance calls are still continuing. In fact, as we speak, we just got an automobile accident coming in on the Schuylkill Expressway, which isn't too far outside of Philadelphia. So we have been actively involved. What's unfortunate for us is we have locked the community out. No community folks are allowed in the fire stations. And we even took it a step further. If you're a volunteer member in another community, or if you work in another community, we really have locked you out of the firehouse until the COVID pandemic is over. But I think the ability to see each member every third or fourth day, according to their shift schedule, emergency medical folks work 24 on, 72 off. That's a little bit of highway robbery. I'm just teasing, but it is a great shift. And bottom line is, for us, we just haven't seen that. And I may not be getting the exact piece out of the question, but the political scene, our political leaders have supported us infinitesimally. They've been incredible about providing the support. We get information from them all the time. And I think maybe where we could truly improve is that we need to have this foundation that you're showing us today. Again, I would just go right back to that ministry of being there. You mentioned the physical seeing and hearing and talking to, and I had a chance to put together a little fire department textbook. It's an old one, so I'm not plugging it, but the first rule is that you simply have to show up. Without being there, nothing good's going to happen. And sometimes you show up and you shut up, meaning just simply being there. I'm a Christian, but coming from the Jewish faith is a process that's described as Shiva. And if I understand it correctly, when a person dies in a family, a Shiva is held shortly after. And the idea is you show up and you don't even talk to the family members until they speak to you, but you're expected to be there. Simply the ministry of your physical presence ends up being pretty huge.
Any other questions or comments, thoughts?
I wonder if there's not, if we could do just a little bit of a wrap up. I know we have a few more minutes left, not much, but from my chair, I think the information that I gleaned pretty clear is to make sure that we hire the correct members on the front end.
I did find the questions. I just had to click on the right button.
Thank you.
All right, so this is, Chief, I think this is a great question. Struggling with a small department to change the culture of mental wellness. Any ideas to change the attitudes, and kind of they went on to say that they know the messaging is very important. Any thoughts about how to kind of change the attitudes and culture around mental wellness in a small department?
I would say you knocked it out of the park with that informal leader. If that informal leader can play a part, if they can get the information and understand the importance. And, it's great to have physical health. It's great to have an amazing department. But honestly, without having the mental health and wellness that you're mentioning, that you're discussing today, what do we really have? So I think getting the folks that really are movers and shakers and influencers involved early. And I'm just going to go back to that great example. The highly well-respected battalion chief in Philadelphia made the impact. It wasn't a deputy chief. They tell me a deputy chief can jump over tall buildings. They tell me that a person that can make the earth shake is an assistant chief, and the fire chief is nearly up in heaven. So I thought it was funnier. But at any rate, with that said, having that person, that captain that won a bronze star on the battlefield, that's impressive, partner. People take notice to things like that. And I'm equating that back to that battalion chief member. So that would be a part. And having the last thing I would say, though, I don't want to lose this thought either, is the chief has got to understand the value of what we're doing and why. The chief has got to be the person that funds it. The chief has got to be the person that has the vision to pull it together. And then they've got to have enough wisdom to get the heck out of the kitchen.
The one thing I'll say is I often use examples when I'm talking with members related to athletics. So sports psychology has become a huge, huge, huge field. Every professional team now has a professional psychologist that works just on human performance, right? So what I would really stress is that, look at people like Russell Wilson and Tom Brady and these super high performing athletes. The reason why they're doing so well is not just because they are incredible athletes, but they practice these skills of mental wellness, whether it's meditation or otherwise, to be the highest performer. So truly, if you want to be the best performer, firefighter in the house, then it's not just about taking care of your body, it's about taking care of your mind. So I think that sort of messaging using athletics is often pretty influential. I want to try to hit a couple of these questions before the time's up, because I kind of saw them roll in now. I just saw it. Peer support teams just came up. So a lot of departments have peer support teams. How does that fit in with NeuroFlow? It's a great question because that's something I think about a lot, because peer support is amazing. I'm a huge proponent of peer support. So there are two ways that peer support really comes into play with NeuroFlow. So we have kind of a crisis resource section within our app where, hey, if something's going on, here's who you call. So we literally plugged in peer support into one of those numbers. So one click, then immediately calls the peer support line here for our area. So that's one option. Certainly promoting it. We have a lot of ability to send any sort of content through the app. So it'd be like, hey, here's what's available to you. Want you to know this is what's going on. And then certainly depending on the structure of the peer support, if they're involved in the EAP, potentially being able to then use the app to send back different resources and things that might be relevant to that person. So you can actually use it as kind of an opportunity to send any sort of relevant information back to that person that they might need. So there's a couple ways peer support kind of fits in. We're not trying to come in and tell you what to do. We're here to kind of support in the existing structure the best we can with the programs that are already ongoing. Yeah, I don't think I'm missing too many here. Let's see. Yeah, I think that's all I have. Any of you guys have any other questions coming through?
I don't. I didn't have, only had the one question that you mentioned earlier. Maybe mine hasn't updated, but I think it's been a great webinar today. The International Association of Fire Chiefs, Gary Ludwig, our president and CEO, cannot thank you enough, Matt, for being here. Of course, the ministry of being with us, providing such amazing, outstanding information and giving us a direction to go in, both through the COVID task force that the people are seeing on the screen and how to directly make contact with you to find out more information. I would say another collection of thoughts is that we've got to select, I think we briefly touched on this, the correct member, or let the correct member join if it's a volunteer system on the front end that's mentally sound and hardy, probably needs to be tested in an appropriate way to make sure that they meet those requirements. And then from the day they join the organization until retirement and even well beyond, they need to be well supported. I got that message loud and clear, and I'd love to be able to tell you that I'm a psychologist or a psychiatrist, and I'm not either. If the building's on fire, I promise generally you won't be around. I try not to bring too much chaos, that being an old joke. Chaos equals chief has arrived on scene, the initials, Matt. But with all that said, to have a core group of great individuals that are high performing, that have delivered great goods to a major metropolitan fire department, it just makes sense to hitchhike. And then I think the other couple of items you mentioned, incentivize to make sure that people feel like they're getting something directly back, and then maybe confidentiality was the other big point I scratched a note on. to ensure folks that their personal information will not get out of the group of folks that's going to help them. The chief of the department, the upper echelon, other members for that matter, really don't need to know. All we need is the output, and that is a healthy mind and a healthy body. With that, again, Matt Nicolette, incredible presentation today. We simply cannot thank you and your organization enough. Do you have any closing comments before we sign off?
No, thanks. Thank you, everybody. I really hope that you guys are looking for ways to implement new programs. So please let me know how I can help. You can also check out NeuroFlow.com. That's our homepage. And if you're looking just for resources for you, NeuroFlow.com /provider burnout. Just have some free resources. So I just encourage you to check it out. Really appreciate everything you guys do.
And Matt, if a person had a question, an afterthought an hour from now, they can use those same mediums to get in touch with you for a response?
That's right. Yep. You guys feel free to email me. It's Matt. It's pretty simple. Matthew@neuroflow.com. Certainly be happy to answer any emails and make sure you get what you need.
Excellent. With that, we're going to sign off for today. Cannot thank all of our viewers and listeners. Tremendous amount of respect that if it weren't for you folks, we wouldn't be able to do these webinars. The International Association of Fire Chiefs, very, very proud to present this weekly series during the COVID-19 pandemic. Dennis Rubin and Matt Nicolette signing off. Thank you so much.
Thanks, everybody.